Hello everyone. Today I'll be talking to you about treatment of frenulum breve, that is tight frenulum. The surgery is known as frenuloplasty. Well, what is frenuloplasty? Frenuloplasty is a surgical procedure that involves the reconstruction or repair of frenulum, which is a small fold of tissue that connects the underside of penis to the glans, that is the head of the penis. When it should be done and why it should be done. Frenuloplasty is usually performed as a treatment for a condition known as frenulum breve, which is a short or a tight frenulum that can cause pain or discomfort during sexual intercourse or even during normal erection. Sometimes it can also lead to torrential bleeding because of forced retraction of foreskin. The procedure involves making a small incision in the frenulum and then either lengthening or repairing it to relieve the tension and allow for more movement during sexual activity. Usually the procedure is performed under local anesthesia or general anesthesia depending on patient preference and surgeon's recommendation. It is usually performed as an outpatient procedure, that is, patient can go home on the same day as the surgery. This is a short video on frenuloplasty. Local anesthesia is given on the penis. A small cut is made to lengthen the tight frenulum using scalpel. Once the surgeon feels he have adequately cut the frenulum is repaired using 40 vicryl rapid suture in running manner. Care should be taken to achieve good hemostasis, and the suture should not be too deep as urethra lies just behind it. We can see we have made an incision in a transverse fascian to lengthen the frenulum, and we are closing in vertical fascian. So this results in a good increase in length of the frenulum, and that finally results in ease of movement of the preputial skin during sexual intercourse. Running sutures are good enough as this will leave minimum knots, and vicryl rapid is a good suture and it gets absorbed on its own. Once this repair is completed, usually it hardly requires any dressing. We can just put betadine ointment on the suture line and ask the patient to apply same and retract the skin back. After the surgery, patient is usually advised to refrain from sexual activity for at least 6 weeks to allow the area to heal properly. Pain medication are usually prescribed to help manage any discomfort during the recovery period. Thank you.